I'll kick off by acknowledging country. So just acknowledge that I'm joining from Wurundjeri country today, and acknowledge as well that everywhere where we're joining from around the country, we're joining from unceded Aboriginal land. And just acknowledge and thank the elders of all First Nations for looking after this country since the Dreamtime. And I know that many people on the call will be committed to restoring a safe climate and looking after the country for future generations as well as our current generations. And just for people who are new today, who might not have joined before, this is Climate Emergency Australia. We're a network of councils from around the country who have declared a climate emergency. And my name is Sally McAdams. I coordinate the network. And I'll tell you more about how you can connect with us later on, as well as some of the things we've got coming up. But we'll head into a little bit of an introduction. So our topic for today, I just shared a link in the chat for those of you who've just arrived. Probably many of you have heard that the Bureau of Meteorology are again predicting one of the hottest summers on record to be coming up. And some of you would have been in the webinar last year when we had Masuda Draki from the Bureau talking to us about the summer that we were expecting last year and how to prepare for an El Nino summer. And I think that you know, in the aftermath of the summer last year, some people may have felt like we didn't quite get what we expected in terms of, you know, it wasn't hot everywhere all the time, and we actually had a lot of floods and storms, a lot of different kinds of extreme weather events. And indeed, the Bureau have said that, you know, we'll see summers getting hotter and wetter, and we'll be seeing more frequent storms this summer, potentially above average rain, and maybe even more cyclones. So, and that we know that doesn't even make us immune to bushfires. So I think maybe the one thing that we can kind of count on is that our summers are going to be increasingly unpredictable, and we're going to be facing all kinds of different events. So it really makes sense to have this webinar today, talking a little bit about how we think about an all hazards approach to disaster preparedness, and also how we perhaps take a resilience approach to preparing our communities. Now, I'll introduce our speakers in full as we get to them, but I'll just mention up front that we have Dr Lai Heng Foong from Bankstown Hospital and Melinda Stephen from Campbelltown City Council in New South Wales, not to be confused with Campbelltown in South Australia. And I'll introduce them fully later. A little bit of housekeeping. Please do stay on mute. As I mentioned, we'll just keep the background noise down, and we are recording. If you have questions along the way, please put them in the chat. We might have time for some hands up and some calling out later on, but do put your questions in the chat as they come to you through the presentations, so we can make sure we capture all of those. And do connect with us, Climate Emergency Australia, through our website. If you're not on our base camp, I'm going to tell you more about that later, but if you're not on our base camp, do email me to get added. All right. So without further ado, I'd like to introduce Dr Lai Heng Foong. She's an emergency physician based in Sydney, and she has a passion for public health and disaster preparedness. She's the chair of multiple committees, including the ones that you can see on your screen there. She's also a member of the Indigenous Health Committee, and this is just to name a few of her connections. And she's also co-authored several book chapters in this area. So she's an absolute expert, and we're very lucky to have her with us here today. Over to you, Lai Heng. You're still on mute, Lai Heng.
Thank you so much for that introduction and for the pleasure of presenting to this group. And I would like to also acknowledge the traditional custodians of the land on which we all meet. I'm ringing in from Gadigal lands, and I believe Sally is going to control my presentation. So next, please. Oh, actually, I can control it too. So, so today I'm going to talk to you about how we need to build community resilience in disasters. And I will share with you a project that I piloted in Southwest Sydney Local Health District, and how we managed to present and help communities out in Southwest Sydney be more heat safe. And the banner that you can see on the left, Beat the Heat, was our campaign last summer, where we included, videos and resources shared to the community to help them with the heat. So I guess, in everything that we do, we always ask why. And my why was because I, as a disaster person, I was seeing more and more disasters happening around, not just in Australia, but also all over the world. We know that climate change is causing disasters to happen more frequently with more severity. And community is always left in the ashes of destruction. We have media companies, flying into the community after a disaster and, trying to, give food packages or whatever. And all of that made me reflect, the fact that we are really not serving the community well by not preparing them for the onslaught of disasters. We know that community resilience has been shown to help with recovery and help with the morale of communities. And there is a big gap in the disaster management, disaster management role at the moment in Australia, in that they are focused more on disaster response and recovery, with only a very small percentage of their funding going into preparedness and prevention. So this is how I landed, and we know that landed with the toolkit. We know that disasters happen when hazards meet vulnerability. We can't really change hazards, and we know that climate change will make us feel the impact of hazards, but we can certainly reduce our vulnerability and also our exposure to prevent all these events from becoming disasters. I would like to, I'm sure I'm preaching to the converted, but I would like you to think about a paradigm shift from disaster response to disaster risk management, and focus on building resilience in each and every community that you work in. So a little bit about resilience. The definition is the sustainability of a community to withstand and recover from disasters. And having a community that's resilient can help them recover faster and better. And I'll talk a little bit more about social capital a little bit later. So I come to my toolkit, which I developed probably a couple of years ago now, recognizing that there is a gap in disaster management. I wanted to build a toolkit that would help the community build their own resilience, empower them. And before that, I was looking at vulnerability assessment of each community. Some communities have already had a vulnerability assessment, but in Southwest Sydney, where I worked, there wasn't that much done in terms of heat, especially. And so I wanted to tap into existing agencies that are already doing that. And I was hoping to have some stakeholder consultation to see how we can better coordinate to make our communities more disaster safe. And I developed an education package that included education for community leaders and one for community members. And I developed a train-the-trainer model to deliver this education package. And the last thing I wanted to link all of this with is early warning systems that are existing. I'm sure that Melinda will talk a little bit more about a few apps that have been developed to reach out to the community and actually give them real-time notification about a disaster coming near them, whether it's floods, bushfires, or heat waves. So just wanted to share a little bit of a timeline of how long it took for the toolkit to be developed and actually then piloted. So I started developing the toolkit at the end of 2022 and had some stakeholder consultation. Through this, there was also a needs assessment that I did. And I was very fortunate to have the Multicultural Health Service in my district pilot this toolkit and with a focus on extreme heat. So we organized a community leaders workshop where we shared the community leaders education PowerPoint. And we had some focus group discussions on how we can improve the presentation and also some enablers and barriers to communicating messages about heat. The toolkit was developed with an all hazards approach, but the community asked for something on extreme heat. I'm not sure how it works in Victoria, but in New South Wales, there are agencies that are in charge of certain disasters. So we have the state emergency services who look after floods, the fire services who look after fires, but heat kind of falls in a hole somewhere between health and disaster agencies, and is historically hasn't been developed very well. So this was sort of created to fill that gap. So after the community leaders education, we then have them deliver the community members a PowerPoint and reach out to their respective communities. We are very lucky that COVID-19 pandemic actually created all these existing networks where some people might be covering refugee populations, some might be covering schools, some might be covering, community health, and they could all have their group or their target audience to deliver the community education. So as they say, a picture speaks louder than words. So I wanted to share with you this photo of two maps next to each other. The one on the left is so this is a map of Sydney and the Greater Sydney area, and the one on the left is percent migrants living in that area. And as you can see, Southwest Sydney has, so the dark red is 50% or more percent migrants, whereas the light yellow is less than 20%. And you can see that Southwest Sydney has a large proportion of our population being migrants. The other map on the right is a map of the mean maximum temperature expressed in annual quintals, with the red being, the highest quintile in terms of mean maximum temperature. So the place where I work has the highest proportion of migrants, but also has the hottest area in Sydney. So with the pilot project, we had three aims. One was to inform community leaders of mitigation and adaptation of climate change-induced disasters, with a special focus on extreme heat. The second is to educate community members about extreme heat and how to protect themselves and their families. And the third was to analyze multicultural communities' disaster risk and resilience by using the Australian Institute of Disaster Resilience Index, which some of you might be familiar with, and anticipating, I guess, a community's risk. So we're hoping that with a top-down and bottom-up approach, with a quantitative analysis of risk and our bottom-up approach, reaching out to community leaders and using a peer education model to empower communities, we can also at the same time harness local knowledge about their disaster risk and their understanding of disaster risk. Just briefly going through the quantitative needs assessment, we use the ADRI index and also the Australian Bureau of Statistics census data, which goes down to statistical area 2 from Western and Southwestern Sydney. And we did a correlation analysis of how these 8 domains, I'll go back to the, so the ADRI scores are categorized into 8 themes, and they are social character, social and community engagement, information access to disasters, community capital, access to emergency services, economic capital, governance and leadership, and planning and built environment. And we mapped this to our Southwest Sydney area and found that there were some negative correlations, especially significant in social character and also community capital and social and community engagement. So I also wanted to point out that Southwest Sydney is one of the areas with lower socioeconomic status in Sydney and Greater Sydney. So just briefly about the analysis, we found that social capital plays an important role in building disaster resilience in multicultural communities. And one of the conclusions is also that disaster resilience building really needs to be transformative to create changes to the existing system. And it's important to focus on abilities of communities rather than their trait, i.e. Speaking English as a second language. So with that, we then did a bottom-up approach, which was to hold a workshop with community leaders with broad representation. It included community health, disaster managers, refugee health, schools, interpreting services, public health unit, and the National Emergency Management Agency. And these are some of the feedback that we got from the community leaders workshop. I won't go through all of them, but I'll share this presentation with Sally. But it was very useful in the sense that they actually, you know, asked what they would like to see in the community education package. And I learned from this stakeholder consultation that for multicultural communities, the word vulnerable isn't actually translatable. So we had to change it to at risk. And some people also commented on the fact that, you know, labeling multicultural communities as vulnerable is triggering and not really very acceptable. And so we did modify, you know, what the content would be by listening to them. And we talked about how we would spread our message about heat. And there were many, many interesting suggestions, including, you know, I actually, even as a Chinese person, I've never really engaged with WeChat. And I found from the Chinese community's point of view, that was the quickest and best way to communicate health messages. And then there are also people who listen to SBS radio in their respective languages. And that was a very popular way to spread messaging about heat. So that was really very, very valuable. And it informed our Beat the Heat campaign later on. So having a heat plan and building community resilience really is the center of disaster preparedness. We know that it saves lives, it will save loss of property, and it shortens time to recovery. And importantly, for the multicultural communities, it helps keep family together, making it more acceptable to them in terms of, I guess, a public health ask. It also builds social capital. And what was really useful using community leaders is that we already had existing network that people could tap into. We had the interpreting service ready to translate fact sheets. I created a heat fact sheet and also an emergency preparedness checklist, and that was translated into languages that was most spoken in that area. And we also did a pre and post survey of the community education. And I just wanted to share some outcomes from the pilot study in Southwest Sydney. So for the heat, extreme heat sessions, we ran 12 sessions and engaged 262 participants in 5 different languages, Arabic, Chinese, Dari, Tongan, and Vietnamese. And we asked them in their survey 7 questions about heat wave and the definition, and also how to minimize the effects of heat wave, the difference between heat exhaustion and heat stroke, as heat stroke is a medical emergency, and then what to do during heat stroke. And as you can see from this graph, the green is their knowledge before the education package, and the orange is after. And in all domains, they almost all domains, the information that was delivered during the education session actually improved their heat wave risk awareness. So I'll see what I just wanted to quickly go through some content. So in the presentation, I had definitions of heat wave. We talked about patterns where Australia's climate has been really increasingly warming since 1910. We talked about health impacts of extreme heat, and for many of our community members, they did not realize that the extreme heat can actually kill. I think people were just kind of thinking, oh, Australia can be hot in the summer, and they really did not realize that heat is actually, the biggest killer in all disasters combined. And they welcome the suggestions of how to keep themselves and their families safe. I wanted to share with you just some data that has recently been published a few months ago, a collaboration between the Australasian College for Emergency Medicine and the Environment Protection Agency in New South Wales. They gave us some funding to do research looking at emergency department presentation, and this research showed that January 2019 was the hottest month on record, and during this time there was an increase by 133% of heat stroke related conditions and dehydration by 63% in New South Wales ED. In addition to direct heat-related diagnosis, heat waves also contributed to the diagnosis of other conditions such as cardiovascular conditions, respiratory conditions, and also mental health diagnoses. This is a very evidence-based and also clear suggestion for how to keep oneself cool. And it was published by an academic in University of Sydney called Ollie J and his team. And what is really good about this infographic is that it actually suggests ways to cool you down without using air conditioning. As we know, using fans can definitely save you energy. So it costs 10% of the electricity that would cost if you use air conditioning to cool yourself and your family down. So I won't go into this because this will be in the presentation, and you can have a look about various ways you can use to cool yourselves down. So just briefly, I wanted to talk about, the innovative strategies or approaches of the toolkit. It leveraged existing partnership, and it was a collaboration between disaster management and the multicultural health service. And I guess for the health planners, this was piloted without any additional funding, just by getting people together and using existing networks for them to educate. So the toolkit also uses a peer education model that's scalable, and it can be replicated and delivered to other communities. And I have delivered this to churches, the Uniting Church, to existing councils, and also to Homes New South Wales, which is the agency that looks after renters and also homeless people in New South Wales. So in summary, we know that climate change is a risk multiplier for disasters, and prevention should really be the aim. And I'm hoping that this education process will prepare people in the community by planning ahead, and also to teach them how to recognize the signs and symptoms of heat exhaustion and heat stroke, and when to call the ambulance, and to look after their more vulnerable family members, and also to preempt every summer to see their GP to review their medications, and hoping to shift the paradigm from disaster response to disaster risk reduction. And we know that the prepared community is a stronger community. And if you have any questions, please feel free to email me. Thanks.
Fantastic. Thank you so much, Lai Heng. And we do have a few questions in the chat. In fact, I think it might even be worth just doing a couple now before we move on to Melinda. So we had one hand up, but one I wanted to go to was Zoe asked, how did you track/identify the increase in heat stroke admissions to hospital in New South Wales? It's a good indicator and KPI for understanding if interventions work, but I understand it's a struggle to identify or specify heat-related injury from other admissions on the day, and also to get the data from LHDs. Lai Heng, do you have any comments on that one?
Yeah, sure. So there is a centralized database that's easily accessible, that the emergency, the ASEM team access, that keeps all emergency presentations by their end diagnosis. So it's something that's that you have to apply for access to, but you can actually get it. So it's much easier than the FREDS, which is the public health database. Of course, it's limited by people actually entering the right diagnosis. So some of the numbers are probably underreporting of the extent of the problem, but they've managed to get the data according to certain search strategy, so heat stroke, heat exhaustion, and subcardiovascular conditions, and link it to heat-related, so presenting complaint or the discharge diagnosis. If people would like this report, I can share it with Sally, and she can send it out to the group. Because it's, as far as I know, it's a landmark study looking at ED presentations, and they looked at actually 3 different climate events. So they looked at extreme heat and for a certain time period. So, during the January 2019, hottest month, they looked at flooding in the northern part of New South Wales, and they looked at bushfires. So there are three kind of time periods that they looked at that had a disaster, and compared the presentations during that time with previous ED presentations, and that's where they got the 133% increase in ED or heat-related ED presentations. In some regional areas, actually, the increase could be more than 300% of heat-related presentations. So, yeah, it's really quite astounding findings. And I've shared it actually in the Victorian faculty conference just a couple of months ago. Because we know that regional and rural emergency departments are usually less resourced, and so having to see 300% increase in heat-related presentations could be quite significant and put a stress on the healthcare system.
Thanks, Lai Heng. People were very happy to hear that you were able to share the link to that paper. We've got a few other questions, but I think we might now hand over to Melinda and then come back to questions later, just to make sure we get time for everything. And if we do run out of time, we can perhaps address the questions afterwards. But Melinda, let's hand over to you now. So Melinda is the Community Partnerships Officer at Campbelltown City Council in New South Wales. She works in sustainability, community engagement, community leadership development, community capacity building, education and behaviour change. She has a postgraduate diploma in sustainability. She's worked in multiple LGAs for state government and in NGOs. And Melinda, over to you.
Thanks so much, Sally, and thanks, Lai Heng. Hi, everyone. I'm going to talk about the Resilient Campbelltown project that I've been working on this year. This project is focused on emergency preparedness for the Pacific Island Nations community, which is the second largest called community in our LGA, the First Nations community, and the Indian subcontinent community, which is our largest called community within our LGA. So the background is that Campbelltown City Council engaged ACOM to undertake a resilience hazard assessment using best practice methodology, which was adopted by Council in May 2022. This research showed that our city is vulnerable to natural hazards such as bushfires, extreme temperatures and heat waves, flash and riverine flooding, and severe storms. Some of our high priority stressors include domestic and family violence, food and housing insecurity, and chronic illnesses, including mental health. So Council applied for and was awarded funding from New South Wales Reconstruction Authority's Disaster Risk Reduction Fund to assist our called communities to prepare for these natural hazards, as daily stressors are known to inhibit the capacity for communities to prepare for shocks. My role started on the 4th of March, and I'm based in the Community Resilience and Partnerships team. And we chose to focus first on Pacific Island nations for a few reasons, then collaborate with the First Nations and Indian subcontinent communities.
Melinda, just let me know whenever you want me to switch slides.
Oh, okay. I found out that I can actually flick them forward myself, so
it doesn't advance. It doesn't advance to everybody else. So just let me know.
Oh, okay. Yeah. Next slide. So up to the project reference group slide. Good to know. Thanks. So unfortunately, the funding was discovered and the application was due before there was time to engage with the communities first. When I approached the Pacific community leaders about the project, they wanted to prioritise mitigation of daily stressors such as mental health, and initially were very reluctant to focus on natural hazard preparation, since their communities face daily emergencies from stressors alone, and they didn't see natural hazards as being much of a risk. So Council provided some funding towards mental health first aid training for the Pacific community at the leaders' request, which alleviated some of their concerns. This created a reciprocal partnership, resulting in the leaders agreeing to support this project. I also gradually engaged the emergency services with the leaders at the monthly New South Wales Council for Pacific Communities meetings in our LGA to answer their main questions and concerns, and this also built trust and they're seeing the value of the project. I asked the main community leaders to nominate members for a project reference group, which resulted in a broad representation of Pacific nations, and 2 members had considerable experience in disaster management within their home nations. I sought and followed the advice of the reference group on all aspects of this project. Next slide. So I sought out staff. Next slide, Sally. Can you hear me, Sally? Next slide.
Yes, are you not seeing it advance?
Oh, yeah, I'm not seeing it advance at my end. Okay, no worries.
Yeah, that might be it.
It's okay, no worries. So I sought out staff from within the emergency services to provide presentations to the community, including Australian Red Cross, New South Wales Rural Fire Service, New South Wales State Emergency Service, and Dr Lai Heng from New South Wales Health. It actually took me the longest to find a heatwave specialist. As Dr Lai Heng says, there's no combat agency for heat waves. And I also engaged Fire and Rescue New South Wales at the community's request to involve them. The Meals on Wheels Act Emergency Preparedness Program also kindly provided our communities with their emergency preparedness toolkits. I arranged a meeting between the reference group and the emergency services to advise the agencies on the best format and approach to delivering the information to Pacific community members. I also collaborated with various teams within Council during the project, as you can see there. Next slide, Sally. We developed maps showing populations of people with Pacific Island ancestry per suburb within our LGA, which you can see to the left. And we overlaid this map with maps of bushfire-prone land within our LGA, which is the second map, and also heat-prone areas within our LGA, which is the map to the right. Flood information was also collated, but not in map form. Next slide. So one goal was to increase awareness and usage of Council's Emergency Help Hub, which contains natural hazard risk reduction information and various community resources. The reference group advised me on the design of a flyer and poster, which was then translated into the 4 main Pacific languages spoken in our LGA: Samoan, Fijian, Maori and Tongan. And these were distributed throughout the community and put on display at libraries, as you can see in the bottom left-hand side of the screen. Next slide. We delivered 4 workshops in total, one for the Samoan seniors group, one for the Fijian church communities, one for a Tongan church community, and the New South Wales Council for Pacific Communities kindly offered to organise a 4th workshop for all Pacific Island nations community members. The workshop format was decided upon by the reference group and included a prayer at the beginning and end of each workshop, in addition to an acknowledgement of country. There was 1.5 hours of short presentations, including saving a link to Council's Emergency Help Hub on participants' home phone screens for easy access. Also downloading and using the Hazards Near Me New South Wales app and the Emergency Plus app. Also included a Red Cross Emergency Ready planning presentation for all hazards, and Rural Fire Service, State Emergency Service, and Dr Lai Heng's presentations on bushfires, severe storms, flooding and heat waves, respectively. Then there was 30 minutes refreshments at the end with time to ask the agencies questions. We used before and after surveys and gave out free emergency packs to all participants. And participant numbers were mostly around the 30 mark. One workshop had 12. And for the Samoan Seniors Group workshop, all presentations and survey forms were translated into Samoan language by a local teacher to increase accessibility. Next slide. So these are the community workshop flyers that were collaboratively developed with the reference group. Next slide. And these are the contents of the free emergency packs, which are given out to all participants. And these included a council waterproof document wallet for things like passports, wills, etc. And emergency preparedness toolkits from the Meals on Wheels ACT program, from Red Cross, and from the Southwest Sydney Public Health Network, which had information on how to maintain your health during a disaster. Next slide. So project evaluation information was obtained from the results of workshop survey forms, from an evaluation meeting with the reference group and other community leaders, and email feedback from the emergency services. There's quite a lot I could say about the evaluation, but just briefly, from 59 surveys, 56 participants said the workshops were very interesting. 3 said they were somewhat interesting. 25 people went from being somewhat confident in preparing for natural hazards to being very confident. 2 went from not confident to very confident, and 5 went from not confident to somewhat confident. 11 people remained very confident, and what was useful for us to know was that 7 people from within the Samoan Seniors Group remained not confident. So that told us that we need more information for that community. 55 people said that they'll share the information they learnt with family and friends. 48 people had never used the Emergency Help Hub before, and 38 said they'd continue to use it. 48 people had never used the Hazards Near Me New South Wales app before, and 36 said they'd like to continue using it. And all except for 9 people said that they wanted information on various topics. One challenge we encountered was the short presentation time per agency versus workshop length that participants could realistically commit to. The leaders suggested as an alternative to that, or as a solution to that, running the workshop in expo format with rotating groups spending 20 minutes with each agency at their own agency stall, or holding several 1-hour workshops with just 2 or 3 agencies per workshop. The community also requested that the emergency services further adjust their presentation style to better accommodate their cultural way of learning. So that was good to hear. There was good feedback to hear. And one of the learnings was to ideally provide stressor mitigation as part of natural hazard risk reduction in order to reduce community barriers to natural hazard preparedness, as Lai Heng touched on in her presentation. The Hazards Near Me app was really helpful during a severe local grass fire that actually broke out just minutes after one of the workshops finished, as the participants got a warning about that fire and were able to better prepare. Some participants did find app download challenging, so we're going to put in some measures to make that easier next time around. And the workshop participants had a good cross-section of Pacific Nations ancestry. And one of the interesting outcomes from these workshops was that the community leaders suggested having a disaster officer nominated within each church. The Pacific Island Nations community is a very faith-based community, and most community members are members of a church. And so a disaster officer in each church community could be communicated with before, during and after a natural hazard event, so that they can best get the information out to their church communities and find out who is most vulnerable vulnerable and most in need and get help to them most effectively. Next slide. So our next steps are that I'm working with the Pacific Community Reference Group to develop 3 social media videos on natural hazard risk reduction, and one of those is heat wave preparedness for seniors in particular, and that's going to have some help from Dr Lai Heng. Thank you very much. And I'm also currently engaging with First Nations and Indian subcontinent community leaders to develop workshops and emergency help hub flyers for them. And I'm also planning to engage the other members of the Community Resilience and Partnerships team that I'm a member of with the emergency services to further increase community preparedness throughout our LGA. So that's all from me for now, and thank you very much.
Thank you so much, Melinda. Really appreciate it. All right, so we're now into question and answer time. I see that a few of the questions that have been asked in the chat have been answered already. Kelly asked about how do we measure the impact of capacity building? Do either of you have some insights into how you've been measuring the impact of the training in the toolkit in terms of practical changes?
So it's through the pre and post survey. So I guess increasing in knowledge, but it's also from feedback just from community members about the usefulness of the presentation. Unfortunately, we don't have any funding for an impact evaluation. And I actually put in an application for funding for the impact evaluation of the pilot project, and unfortunately, it didn't get funded. So George Institute was really interested in helping me with impact evaluation, but I guess short of doing kind of a proper impact evaluation, we just had some really good feedback from participants from the pilot and also from the increase in knowledge shown in the survey.
Thanks, Lai Heng. Melinda?
Yeah, I would just add that we've only just finished our workshops very recently, and because one of the really great outcomes of this project was that it strengthened even more our team's relationship with the Pacific Island community and with the community leaders. And so what I intend to do for the remainder of this time that I'm working on this project, even while I'm partnering with the First Nations and Indian subcontinent communities, is do my best to, stay in touch with those church and community leaders who do know the participants of the workshops, and just keep touching base to try to find out how they are going with implementing some of the learnings. And ideally, I'd like to bring that into the pre-planning for the First Nations and Indian subcontinent communities in terms of, how we could track that over time. It is a bit hard. My role is a temporary contract role based on this funding agreement. And this was a pilot project for Campbelltown City Council. So I think that there will be a lot of really good learnings for Council based on this, and discussions that can come in terms of, between different teams in terms of how we can continue to develop this further and track what's needed. The Pacific community said that they wanted annual workshops from now onwards to keep reinforcing the information that was given out to people who'd already done the workshops, and to reach out further to people who hadn't done this. And that's a big shift from where the community was at the beginning of the project, when there was a strong reluctance to participate in the project. So I think that in itself was a really great outcome and shows that the leaders want to continue to monitor how prepared their communities are and maintain, keep building on that momentum.
Thanks, Melinda. Verinda, I know you had your hand up before. Did you still want to ask a question?
Yes, thank you, Sally. Really, yeah, beautiful presentations, and the way it has been compiled, I'm really impressed. Now, I just want to share my thoughts in relation to one thing which I think when it comes to the multicultural society, and it brings its own kind of challenges. I think one of the sector which we have, not only in this aspect and other domains we are missing, is education system. So when it comes to and the way Dr. Foong has mentioned before, that how vulnerability is a different meaning. And I guess even though I'm not overlooking or undermining the considerations to interpretation and all those TIS services we do have, but what I have found, my personal lived experience, kids in school, they are the best interpreter, and they do consider automatically when it comes to their cultural beliefs and everything. So I guess this need to be inculcated at some stage somehow within our education system, and it will do its magic in its own ways. In addition to, and there won't be any cost when it comes to the way we are struggling in current economic climate when it comes to the funding. I know these frameworks, they are based mostly at a federal or state level, but when it comes to decentralized execution of the same things, so what Melinda has shared, the challenges she has been going through in terms of, and same way Dr. Foong did mention that resources or funding challenges. So I guess that's where we do need to work together and need to engage the third tier of the system, government system, local government system. So that's probably my, not a question, but I guess my inputs or 2 cents would be in, if we can put these old dots together, this will bring magic in itself. Thank you.
Thanks, Verinda. And I can see that Lai Heng and Melinda both want to respond.
Yeah, thank you so much, Verinda. That's a really good point. And, one of the areas that people have highlighted to spread the message is through schools. And we're trying to access that. But in New South Wales, you have to get special permission for any kind of education that's outside the curriculum. So we are going through that process now. In a more so if you go to a school, for example, you must get the Department of Education permission. So we have some others that are a bit more informal, targeting school children, because yes, the multicultural communities have fed back that the younger kids are the ones that speak English very well, and so they understand the messaging and they can bring it to their parents and also their grandparents. So, but our barrier is the Department of Education at the moment. So, hopefully they'll approve it, and we can actually share this package to schools.
Thanks, Lai Heng. Go for it, Melinda.
Yeah, I also wanted to share that I tried really hard to have workshops for the Ambervale High School within our LGA, which has a really high percentage of Pacific Island nations kids. And the cultural liaison officer at the school was reluctant to go ahead because of the quite onerous permissions process, as Lai Heng just mentioned. And, that was unfortunate. But yeah, I had to just, kind of go along with what their advice was. They just didn't have the capacity and they didn't have the time to go through those processes. To enable us to run a workshop there. However, they did invite us to a Pacific Youth Leadership Expo, and the Resilient Campbelltown project had a stall at that expo at which there were young people from 5 different high schools within our LGA who were of Pacific Island nations ancestry. And so thankfully we did get a chance to show the young people the natural hazard risks within our LGA using our map overlays, and talk about the emergency help hub with them, show them the help hub, and discuss the project with them. That was before the workshops, and I then wanted to go on and do a workshop there, but unfortunately that wasn't possible. I will try again for the First Nations and Indian subcontinent communities, and I'll see how I go. But yeah, I completely agree. It would be
Good on
great
you.
to have
Thank
that
you,
with kids.
Melinda. Yeah, and we have only a few minutes left, so I'm sorry that we haven't gotten to every single question. I do see that quite a few of the questions were about how can we access the different documents. I will definitely be able to share links and documents on our Basecamp, and I'll make that particular folder a public one that everybody can access. But it also leads me on to my to the wrapping up section, and I'll just mention that we have this Basecamp that I've been mentioning. It's an online forum. There are over 450 officers on there who are exchanging information, and we also try to keep it up to date with all of the resources that we collect. So, for example, we'll be posting this recording, we'll post the presentations, we'll post all the links and documents on this Basecamp. And in fact, we've just added something new at the request of our members. We have a new feature called the Project Library. Melinda's project is in here already. We'll add the stuff from today as well. So I would really encourage you, don't just rely on the public links. Do contact me if you're not a member of the Basecamp so that I can connect you in, and that way you can be part of the conversation. There are other ways to connect with us as well through our website, through just contacting me directly. Of course, I would love any councils here who are not members already to become councils, because we are entirely member funded, so that's how we are able to keep going. Absolutely, WA participants can become members of the Basecamp. It's open to everybody, and it is a national network. So yeah, everybody's welcome. We also have some upcoming training for senior leaders in local government in governing in the climate emergency. So if you haven't clued into that already, check that out on our website. Melinda's just put her contact details in the chat there for anybody who wants to reach out. You've seen Lai Heng's, and that will be shared in the presentation as well. So I'll just finish up by saying a really big thank you to Dr. Lai Heng Foong and to Melinda Stephen for joining us today. Thank you for your wonderful presentations. Thank you everybody for being here. Really appreciate the conversation. And I will certainly send out all the follow-ups so that you can get access to all that good stuff. So thanks so much, everybody. We'll see you next time. Bye.
Thank you so much. And
Thanks,
get
Sally.
in touch with me if you'd like me to, deliver the community leaders presentation. You have my email. Thank you.
Thank you, Lai Heng.
Thank you.
Yeah. Thanks, Sally, for organizing this. And
Thank you so
Melinda
much
for coming.
Thanks, Lai Heng.
Well,
Thank you.
yeah.
Bye.
Okay, bye.